The explosion tore through the engineering deck at 0347 hours. Taeyang was in the medical bay reviewing supply logs when the ship lurched violently to one side. Red lights flooded every corridor and the alarm system screamed its warning into the recycled air. She grabbed her emergency kit without thinking. Years of training made her body move before her mind fully processed what was happening. The kit felt light in her hands as she ran toward the source of the chaos. Her boots pounded against the metal floor, each step echoing in the narrow hallway. The communication system crackled to life above her head. Captain Heejin's voice cut through the noise, calm but urgent. Medical team to engineering deck. We have casualties. Repeat casualties in engineering. Taeyang reached the damage section 3 minutes after the explosion. The scene that greeted her made her stomach tighten. Metal panels hung from the ceiling like broken teeth. Smoke filled the air, making it hard to see more than a few meters ahead. She pulled her breathing mask tighter against her face. 2 crew members stumbled past her, supporting each other. One had a nasty cut across his forehead, blood running down into his eyes. The other limped badly but seemed alert. Taeyang pointed them toward the medical bay. Go, someone will treat you there. I need to find the worst cases. She moved deeper into the wreckage. The ship's artificial gravity flickered, making her feel momentarily weightless before slamming her boots back to the floor. Through the smoke, she saw him. Minho lay pinned beneath a collapsed support beam. His breathing came in short, painful gasps. Blood pooled beneath him, dark and spreading fast. Too fast, Minho! Can you hear me? Taeyang dropped to her knees beside him, her hands already assessing his injuries. She did not need her medical scanner to know this was bad. Very bad. His eyes opened slightly. Hurts, he managed to whisper. Can't breathe right. I know. Stay with me. Help is coming. She spoke clearly, keeping her voice steady even as her mind raced through the list of injuries she could see. Compound fracture of the left leg. Possible internal bleeding. Chest injuries, probably punctured lung. His skin had an odd color to it. The telltale sign of exposure to vacuum, even if only briefly. The sound of crystalline footsteps approached. Medical supervisor Vreet arrived, her translucent body catching the emergency lights and scattering them into rainbow patterns across the walls. Behind her came Thren, the insectoid medical officer, his multiple arms already holding various scanning devices. Vreet's voice emerged from the translation device at her center. Status report. Multiple trauma. We need to move him now. Taeyang kept pressure on the worst bleeding while she spoke. Thren's scanners hummed over Minho's body. The devices beeped and chirped, feeding data directly to Vreet's internal systems. The crystalline alien processed the information in seconds. Severe internal damage. Fractures in 3 locations. Lung puncture. Exposure damage to surface tissues. Vreet's voice carried no emotion, just facts. Standard protocol requires immediate stasis followed by transport to the nearest medical facility. How far is that? Taeyang asked, though she already knew the answer would not be good. 3 weeks at maximum speed. He won't make it 3 weeks. Taeyang looked up at Vreet, meeting what she assumed were the alien's eyes. Look at the blood loss. Look at his breathing. We put him in stasis now, the damage will progress. His body is still trying to compensate. Stasis will freeze him in this critical state. The statistics disagree. Stasis survival rate for this injury level is 94.7%. Vreet moved closer, her body making soft chiming sounds. Your emotional response is understandable but not medically sound. Taeyang felt anger flash hot in her chest, but she pushed it down. Getting angry would not help Minho. I'm not being emotional. I'm reading his body. These numbers your scanner shows you, they don't account for the specific pattern of damage. They're averages. More crew members arrived to help clear the debris and move the injured. Sunwoo, another human doctor, appeared at Taeyang's side. He looked at Minho and his face went pale. We need to operate, now. Taeyang said it quietly but firmly. Sunwoo's eyes widened. Here? We don't have facilities for this kind of surgery. We have medical supplies. We have hands. We have knowledge. Taeyang began carefully checking Minho's vital signs manually, her fingers finding his pulse, checking his pupil response. We can do this. Vreet made a sound like wind chimes in a storm. Impossible. Surgery requires proper facilities, sterile environment, AI-assisted precision, regeneration tanks for tissue repair. What you suggest is primitive. Primitive works when sophisticated isn't available. Taiyang looked at the alien medical supervisor. My species has been doing emergency surgery in terrible conditions for thousands of years. Battlefields, natural disasters, shipwrecks. We learned because we had to. That was before modern medicine. Thren spoke for the first time, his voice clicking and buzzing through his translator. Surely you do not still use such methods. We do when we have to. And right now we have to. Taeyang stood up, facing both alien medics. I need to speak with the captain. Captain Hyejin arrived moments later, her uniform torn at the shoulder but otherwise unharmed. She assessed the situation with quick, practiced eyes. Options. Vreet explained the protocol. Stasis, then transport. Safe. Proven. By the numbers, it was the right choice. Taeyang explained her alternative. Immediate surgery. Risky. Improvised. By human standards, it was the only choice. The captain looked at Minho, then at Taeyang, then at Vreet. Survival rate with stasis? 94.7%, Vreet repeated. Survival rate without? Taeyang met the captain's eyes. With the surgery? 70%, maybe 80% if everything goes right. Without it? 0. He'll die before we're halfway to any facility. The silence stretched for long seconds. Somewhere in the ship, another alarm began to sound. The engineering crew was still fighting fires and sealing breaches. Every second they delayed, Minho's condition worsened. Captain Hyejin made her decision. You have 6 hours to stabilize him, Taeyang. If you can't, we go with protocol and hope Vreet's numbers are right. She turned to the alien supervisor. Vreet, I need you to assist her. Consider this a joint operation. Captain, I must protest logged. Hyejin's voice carried the weight of command. But that's an order. We're in unknown space, weeks from anywhere. If Taeyang says we need to adapt, then we adapt. That's what humans do. Vreet's body dimmed slightly, a sign of distress that Taeyang had learned to recognize. But the alien nodded. Acknowledged. I will observe and assist as requested, though I believe this course of action is ill-advised. Noted. Taeyang was already moving, organizing what needed to happen. Sunwoo, help me move him to the cargo bay. We need space. Vreet, Thren, I'll need your scanners and any supplies you can spare. Captain, I need volunteers for blood donation. His type is common enough. As they carefully lifted Minho onto a transport stretcher, his eyes opened again. He looked at Taeyang with a confused, pain-filled expression. Am I going to die? His voice was barely a whisper. Taeyang smiled, squeezing his hand gently. Not if I have anything to say about it. Now save your strength. You've got a surgery to survive. They moved through the damaged ship. A strange procession of humans and aliens carrying a dying man toward what Vreet believed was certain failure, and what Taeyang knew was his only chance. The cargo bay had been cleared in record time. Crew members worked together, moving containers and equipment to the walls, creating a space in the center that was roughly 10 meters square. It was not a surgical theater. It was not even close to sterile, but it would have to do. Taeyang directed the setup with quick, precise instructions. Lights here, here, and here. I need maximum visibility. Sunwoo, start setting up the monitoring equipment. Basic is fine. I just need to know heart rate, blood pressure, and oxygen levels. Vreet watched from the edge of the space, her crystalline form reflecting the harsh work lights being installed. This is inadequate. The contamination risk alone is unacceptable. We'll manage it. Taeyang did not look up from her work. She was laying out tools, checking supplies, mentally running through the procedure step by step. Humans have performed surgery in worse conditions than this. That statement requires evidence. Thren moved closer, his multiple eyes focusing on the primitive setup. Modern medical standards exist for specific reasons. Deviation from protocol results in increased mortality. Sunwoo paused in his work, looking uncomfortable. He was a good doctor, but most of his experience came from well-equipped facilities. This kind of field medicine was outside his usual practice. Taeyang, maybe we should reconsider. If the statistics say stasis is safer, the statistics don't know Minho. Taeyang finally stopped and faced the others. Look, I understand your concerns, I do. But I've seen injuries like this before. During the Mars colony disaster. During the Europa rescue operation. I know what I'm looking at, and I know what happens if we wait. A new voice entered the conversation. Jiwon, the human xenobiologist, stepped into the cargo bay. She was not medical personnel. But she had worked with alien species for years. Maybe I can help explain. She walked to the center of the space, looking between the humans and aliens. Freet Thren, your medical technology is more advanced than ours in many ways. Your regeneration tanks can heal wounds we can only dream of fixing. Your AI systems can predict complications before they happen. But there's something you need to understand about human medicine. What is that? Freet's voice carried genuine curiosity. We built our medical knowledge from the ground up in the worst possible situations. Jiwon pulled up a holographic display from her tablet. Images appeared in the air. Battlefield medics working under fire. Doctors in disaster zones with limited supplies. Surgeons on early space stations with basic equipment. Every major advancement in human medicine came from someone asking, "How do I save this person with what I have right now?" Thren studied the images with several of his eyes. These conditions are barbaric. They were necessary. Jiwon expanded one image showing an old photograph of a surgery being performed in a field hospital. This is from Earth about 200 years ago. The doctor here saved 16 lives in one day with equipment that would look like toys compared to what we have now. The tools don't make the doctor. The knowledge and skill do. Freet's body pulsed with a soft light, her way of expressing deep thought. You are suggesting that human medical practice is built on improvisation rather than optimal conditions. Exactly. Taeyang joined the conversation again. We learned to work with what we have because for most of human history, we didn't have much. That knowledge doesn't disappear just because we now have better tools. It's still there, still valid, still necessary when the better tools aren't available. Navigator Dayun appeared in the doorway. She was off duty but had heard about the situation. Is there anything I can do to help? Actually, yes, Taeyang looked at her. We're going to need blood. Minho's type is B positive. Common enough. Can you organize donors? Already done. 6 volunteers waiting outside. Dayun smiled slightly. Word travels fast on a ship this size. Everyone wants to help. Sunwoo finished setting up the monitoring equipment. The machines hummed to life, their displays showing ready status. We're as prepared as we can be with what we have. Captain Hejin entered the cargo bay, her presence commanding immediate attention. Status? We're ready to begin. Taeyang checked her chronometer. It's been 40 minutes since the explosion. Every minute we wait, Minho's condition degrades. The captain looked around the improvised surgical space. Freet, I need your honest assessment. Not protocol, not statistics. Your actual medical opinion. The crystalline alien was quiet for a long moment. When she spoke, her voice was different, less mechanical. I believe this procedure has a higher risk of failure than standard protocol. However, I also acknowledge that Dr. Park has experience I do not. My species has not performed surgery without full technological support for over 1,000 years. We have forgotten what it means to work without our systems. Can you support her during the surgery? I can provide scanning and monitoring support. My internal processors can track multiple vital signs simultaneously and alert Dr. Park to any complications. Freet moved closer to the surgical space. I remain skeptical, but I will assist to the best of my ability. That's all I ask. Captain Hejin turned to Taeyang. You have your 6 hours. Use them well. Taeyang nodded. Thank you, Captain. Sunwoo, bring Minho in. Let's get him on the table. They carefully transferred the injured engineer to the makeshift operating surface. Minho was unconscious now, his body shutting down to conserve energy. His breathing was shallow and irregular. The monitors began displaying his vital signs, and none of them looked good. Taeyang scrubbed her hands thoroughly, using the portable sterilization unit they had set up. It was not perfect, but it would reduce the infection risk significantly. Sunwoo did the same, his hands shaking slightly. You okay? Taeyang asked quietly. Nervous, Sunwoo admitted. I've never done anything like this, just follow my lead. I'll talk you through every step. She pulled on her surgical gloves. Remember, we're not trying to be perfect. We're trying to keep him alive long enough for his body to start healing. That's all. Freet positioned herself at the head of the table, her scanners active. I am reading severe internal bleeding in the abdominal cavity. The left lung has collapsed. Multiple fractures, as previously noted. His blood pressure is dangerously low. I know. Taeyang picked up her first tool, a simple scalpel. That's why we're starting now. Sunwoo anesthetic. Light dose. I need him sedated but not completely under. His body needs to keep fighting. Jiwon and Dayun watched from a safe distance. Other crew members had gathered outside the cargo bay, looking in through the windows. Human and alien faces pressed against the glass watching this strange human ritual. Thren made a clicking sound. In our medical practice, the patient would be fully sedated and placed in suspended consciousness. Why keep him partially aware? Because his body knows how to heal itself. Taeyang positioned her scalpel. I'm just helping it along. If I knock him completely out, his natural responses shut down too. This way, his body keeps compensating, keeps trying to fix itself. I'm working with his biology, not against it. Fascinating. Vreet's voice held a note of interest. This is similar to how our ancestors practiced medicine before we developed regeneration technology. We have records, but no living practitioner has used these methods in my lifetime. Then watch carefully. Taeyang looked at her patient, at Minho's pale face and shallow breathing. You're about to see medicine the human way. It's not pretty. It's not by the book. But it works. She took a deep breath and made the first incision. Blood welled up immediately, and Sunwoo moved in with suction to keep the field clear. The surgery had begun. Around them, the ship continued its emergency repairs. Alarms still sounded in distant sections. The damage from the explosion was extensive, and it would take days to fully assess and fix everything. But in this cargo bay, converted into an operating room, time seemed to slow down. Taeyang worked with steady hands, her movements confident. This was what she had trained for. This was what humans had been doing for thousands of years, fixing each other with whatever tools they had available. Refusing to give up, refusing to let death win without a fight. 3 days after the surgery, Minho opened his eyes. Taeyang was checking his vital signs when it happened. One moment he was still, the next his eyelids fluttered and then opened. He looked confused, disoriented, struggling to understand where he was and what had happened. Easy. Taeyang put her hand on his shoulder, gentle but firm. Don't try to move too much. You've been through quite an ordeal. What? What happened? His voice was rough from the breathing tube that had been removed the previous day. Explosion in engineering. You got hurt pretty badly, but you're okay now. You're going to be fine. She smiled at him, genuine relief flooding through her. Every patient who woke up felt like a small miracle. Minho tried to sit up and immediately regretted it. Pain shot through his body, making him gasp. Everything hurts. That's actually a good sign. It means your nerves are working properly. Taeyang adjusted his bed, raising it slightly so he could see better. You had surgery. Emergency surgery. It's going to hurt for a while. His eyes widened. Surgery here. On the ship? Right here. In the cargo bay, actually. She checked his pupil response, his reflexes, all the standard post-operative assessments. You were too injured to wait for a proper facility. So we improvised. We? Dr. Sunwoo assisted. And we had help from Vreet and Thren. Taeyang made a note on his chart. It was a team effort. Minho seemed to be processing this information slowly. The alien doctors helped? They did more than help. Vreet's scanners gave me information I could never have gotten otherwise. Thren's extra hands were invaluable. Taeyang sat down in the chair beside his bed. They learned something, and so did I. In another part of the ship, Vreet was doing exactly what Taeyang said. Learning. The crystalline alien had spent the past 3 days reviewing everything she knew about medicine. Not just her own species' medicine, but the medical practices of every species in the Galactic Collective. And then she had started researching human medicine specifically. What she found astonished her. Humans had been performing surgery for over 4,000 years. They had developed techniques for working in battlefields and wilderness and disaster zones, in space stations with minimal equipment. Every challenge they faced, they adapted to. Vreet pulled up a historical file. A human surgeon from Earth, nearly 300 years ago, performing an appendectomy on a submarine. Another file showed field medics during some ancient war, treating wounds with whatever they could find. Another showed the first surgery performed on Mars in a habitat with basic life support and nothing else. The pattern was clear. Humans did not wait for perfect conditions. They worked with what they had. Her research caught the attention of the Galactic Medical Collective. They had been monitoring the situation since Captain Hyejin's initial report. Now they requested a full briefing. The holographic conference room filled with representatives from a dozen species, medical experts, researchers, administrators, all waiting to hear about the human doctor who had performed successful surgery without proper facilities. Vreet presented her findings with clinical precision. She showed them the scans of Minho's injuries. She walked them through the procedure Taeyang had performed. She explained each decision, each technique, each moment where human medicine differed from galactic protocol. This should not have worked, one of the administrators said. The risk factors were too high. The lack of proper equipment should have resulted in failure. And yet it did work. Freet displayed Minho's current vital signs. The patient is recovering ahead of all projected timelines. His prognosis is excellent. A medical researcher from a water-dwelling species spoke up. How is this possible? We have developed our techniques over thousands of years. We have eliminated these primitive methods specifically because they were less effective. I believe we eliminated them because we no longer needed them. Freet said slowly, working through her thoughts as she spoke. Our technology advanced to the point where we could always provide optimal conditions. So we optimized for those conditions. Humans could not. Their evolution, their history, required them to maintain the ability to work in suboptimal conditions. Another voice joined the conversation. This one was human. Kyungmin appeared on the holographic display, calling in from Earth's Medical Research Center. He was older, his hair gray, but his eyes were sharp with intelligence. Medical Supervisor Vreet is correct, Kyungmin said. Human medicine developed alongside human exploration. When our ancestors went to sea, they needed doctors who could work on ships. When we went to space, we needed doctors who could work in habitats and stations. We never had the luxury of waiting for perfect facilities. He pulled up his own displays, showing the history of human medical advancement. Every major development in human medicine came from asking one question. How do we help people when we can't get them to a hospital? That question drove innovation in ways that peace and prosperity never could. Vreet listened, absorbing this information. You are saying that limitation became strength? Exactly. Kyungmin smiled. We learned to make do. And that skill never went away, even when we developed better technology. Dr. Park could work in that cargo bay because generations of human doctors before her learned how to work in worse conditions. The conference continued for hours. Questions were asked, data was examined, theories were proposed. By the end, the consensus was clear. Human medical practices represented a valuable addition to galactic medicine. But it was not just humans who benefited from the exchange of knowledge. Taeyang found herself learning from Vreet as well. The crystalline alien's scanning abilities were remarkable. She could detect chemical imbalances, identify infections, predict complications before they became serious. Her medical knowledge was vast, covering species and conditions Taeyang had never encountered. I've been reviewing your surgical technique, Vreet said one evening, as they both sat in the medical bay. Minho was sleeping peacefully nearby, his recovery progressing well. There is elegance in its simplicity. Thank you. Taeyang was surprised by the compliment. And I've been amazed by your diagnostic abilities. The way you can see inside the body without any invasive procedures is incredible. Different species, different strengths. Vreet's light pulsed gently. I am beginning to understand that optimal medicine may not be about having the best technology. It may be about combining all our strengths. Over the next week, something remarkable happened. Other crew members who had been injured in the explosion received treatment using a combination of human and alien techniques. Taeyang would perform procedures using her hands-on approach, while Vreet provided real-time scanning and monitoring. Thren would assist with his multiple limbs, making complex procedures easier. The results were impressive. Recovery times improved. Complications decreased. The patients felt more connected to their care, understanding what was happening rather than simply being placed in machines. Captain Hyejin observed all of this with satisfaction. You've started something, Taeyang. Something bigger than just one surgery. I just did what needed to be done. Taeyang was uncomfortable with the attention. That's what makes it matter. The captain smiled. You did not ask for permission. You did not wait for ideal conditions. You saw a problem and fixed it. That's very human of you. Minho's recovery continued to exceed all expectations. 2 weeks after the surgery, he was sitting up, eating solid food, joking with visitors. His leg was healing. The chest tube had been removed. The scars would fade with time. I owe you my life, he said to Taeyang during one of her checkups. You owe it to your own body. She replied, I just helped it along. Your body did the hard work of healing. Vreet said the surgery was remarkable. She said it should not have worked, Taeyang laughed. Vreet says a lot of things. But she's learning. We all are. In the galactic medical databases, new protocols were being written. Human emergency response procedures, they were called. HERP for short. The name made Taeyang laugh when she heard it, but the content was serious. Doctors across the galaxy began learning human techniques, not to replace their own methods, but to supplement them. For situations where technology failed, for remote locations, for emergencies where waiting was not an option. And in return, humans learned from alien medicine, new scanning techniques, better understanding of biochemistry, treatment methods that had never occurred to human researchers. The exchange of knowledge benefited everyone. Vreet came to Taeyang one evening with a request. The Central Medical Academy has asked if you would come teach a course on human field medicine. They want to learn directly from someone who practices it. Taeyang was stunned. They want me? I'm just a field medic. You are a doctor who saved a life in impossible conditions. Vreet's voice was warm. You are exactly who they need to learn from. Will you go? Taeyang looked at Minho sleeping peacefully in his bed. She thought about the cargo bay surgery, about working with limited tools and unlimited determination. She thought about all the human doctors throughout history who had done the same. Yes, she said finally. Yes, I'll go. Someone needs to teach them that the most important medical tool is not technology. It's the refusal to give up. The first challenge was the bleeding. Blood pooled faster than Sunwoo could clear it, making it difficult to see the damaged tissues clearly. Taeyang worked by feel as much as sight, her fingers identifying organs and blood vessels through touch. Ruptured spleen. She spoke calmly, as if discussing the weather. I'm going to need to remove it. Humans can live without a spleen. It'll make him more susceptible to infections, but that's a problem for later. Vreet's scanners hummed. Removing an organ without regeneration backup seems extreme. It's leaking blood into his abdominal cavity. If I leave it, he'll bleed out in the next hour. Taeyang's hands moved with practiced precision. Sunwoo, clamp here, good, now here, perfect. Thren watched with fascination, all of his eyes focused on the procedure. You work without visual enhancement, without AI guidance. How do you know where to cut? Anatomy is anatomy. I studied for years to learn where everything is, how it connects, what it does. Taeyang tied off a blood vessel. The human body is a map. Once you learn to read it, you can navigate even when you can't see perfectly. The monitors beeped steadily. Heart rate was holding stable at 90 beats per minute. Blood pressure was still low, but not dropping further. Small victories. Daeun appeared with the first blood donor. A young engineer named Juan volunteered to give blood. The transfusion started, fresh blood flowing into Minho's veins to replace what he had lost. His color improved slightly, a good sign. Spleen is out. Taeyang placed the damaged organ in a container. Now for the lung. Sunwoo, I need you to hold this retractor. Keep the ribs spread so I can see what I'm working with. Sunwoo did as instructed, though his face showed his discomfort. Surgery was never pleasant to watch, even for doctors. There was something primal about seeing the inside of another person, seeing the mechanical reality of how bodies worked. The collapsed lung was visible now, deflated like a balloon with a hole in it. Taeyang examined it carefully, her gloved fingers gentle despite the urgency. Puncture here, about 2 centimeters. Not terrible, but it needs to be sealed. Standard protocol would be tissue regeneration, Vreet observed. The wound would be stimulated to heal at an accelerated rate. We don't have that technology here. Taeyang selected a different tool. So we do it the old way. Surgical glue and stitches. It won't be perfect, but it'll hold until natural healing can take over. She worked on the lung with intense concentration. This was delicate work. Lung tissue was thin and fragile. Too much pressure and she could make the tear worse. Too little and the seal would not hold. Her hands moved with a surgeon's precision, learned through years of practice. Heart rate increasing, Vreet announced. 110 beats per minute. He's compensating. That's good. Taeyang did not look up from her work. His body is working with me. Sunwoo, be ready with the chest tube. Once I get this lung reinflated, we need to make sure it stays that way. 20 minutes passed. Then 30. The lung repair was holding. Taeyang carefully reinflated it, watching as the pink tissue expanded and began its rhythm of breathing again. The monitor showed oxygen levels improving. Chest tube in place, Sunwoo reported. Drainage is minimal. Perfect. Taeyang straightened slightly, easing the strain on her back. Now the leg. That fracture needs to be set before we close him up. The compound fracture was ugly. Bone had broken through skin, and the leg was bent at an unnatural angle. Freet made a sound like breaking glass when she saw it clearly. This requires bone regeneration therapy. The damage is too severe for simple setting. The crystalline alien's voice carried certainty. Watch and learn. Taiyang cleaned the wound carefully, removing debris and damaged tissue. Thren, I need your help here. You've got more hands than I do. The insectoid doctor hesitated, then moved forward. What do you need? Hold here and here. When I say pull, you pull gently but firmly. I need to align these bone fragments. Taiyang positioned her own hands. Ready, pull. Thren pulled. The bone fragments shifted, grinding together. Minho groaned in his sedation, his body responding to the pain even through the anesthetic. But the bones aligned, sliding back into their proper positions. Hold it steady. Taiyang worked quickly, inserting pins and plates to hold the bones in place. The materials were basic, nothing like the advanced biocompatible implants used in proper facilities. But they would work. They had to work. This seems barbaric, Thren said quietly, though he continued to hold the leg steady. It is. Taiyang agreed, but barbaric and effective beats civilized and dead. He'll have scars. He'll need physical therapy, but he'll walk again. Another 30 minutes passed. The leg was stabilized. The monitors continued their steady beeping. Blood pressure was slowly climbing. Oxygen saturation was almost normal. Minho's body was responding to the treatment. Then the monitors screamed. Cardiac arrhythmia. Vreet's voice rose in pitch. Heart rhythm is becoming chaotic. Taiyang saw it immediately. Minho's heart was struggling, the electrical signals misfiring, probably from stress, from blood loss, from the trauma his body had endured. The monitors showed the characteristic pattern of a heart about to fail, charging defibrillator. Sunwoo moved fast, grabbing the portable unit from the emergency kit. Wait. Taiyang put her hand on Minho's chest, feeling the irregular beating beneath his ribs. Not yet. Vreet, what's his potassium level?
Scanning.
Dangerously low. The blood loss must have depleted his electrolytes. That's the problem. His heart doesn't have the chemical fuel it needs. Taiyang grabbed a syringe, filling it quickly. We balance his electrolytes, the rhythm should stabilize on its own. Should? Thren's voice carried doubt. Nothing in medicine is guaranteed. Taiyang injected the solution into Minho's IV line. But this is more likely to work than shocking a heart that's already weakened. They waited. Seconds ticked by. The monitors continued their chaotic beeping. Taiyang kept her hand on Minho's chest, feeling his heart beneath her palm. Slowly, gradually, the rhythm began to even out. The wild irregularity smoothed into something more organized. The monitor's alarm silenced, replaced by steady beeps once more. Heart rhythm stabilizing. Vreet sounded surprised, returning to normal sinus rhythm. Taiyang let out a breath she had not realized she was holding. Crisis averted. Sunwoo, let's close him up. We're almost done. The final stage of the surgery was almost meditative. Sutures layer by layer, rebuilding the body wall. Taiyang worked with practiced efficiency, her earlier urgency replaced by careful precision. Each stitch was placed perfectly, each layer closed properly. Captain Hyejin had returned to watch. She stood beside Jiwon and Dayun, observing in silence. Other crew members still pressed against the windows, their faces showing a mixture of fascination and concern. Final count, Taiyang said, as she placed the last external suture. All tools accounted for? All accounted for. Sunwoo confirmed, checking their inventory list. Bleeding under control. Minimal drainage, all expected post-operative amounts. Vreet reported, her scanner still active. Vital signs? Heart rate 95. Blood pressure 100/60. Oxygen saturation 98%. All improving. The crystalline alien paused.
He is stable. Taiyang stepped back from the table, pulling off her bloody gloves.
Her hands were steady, but she could feel the exhaustion starting to creep in. 4 hours of intense concentration. 4 hours of holding someone's life in her hands. He's going to make it. She said it quietly, almost to herself. The cargo bay erupted in applause. The crew members watching began to cheer, humans and aliens together. Sunwoo was smiling, tears in his eyes. Even Vreet's crystalline form seemed to glow a little brighter. Captain Hyejin approached, respect clear on her face. Well done, Doctor. I knew I made the right choice. Taiyang looked at Minho, still unconscious but breathing steadily on his own. His color was better. His vital signs were stable. He would need days of recovery, maybe weeks, but he would recover. That, Freet said slowly, was the most remarkable medical procedure I have ever witnessed, not because of the technology used, but because of its absence. You worked with knowledge and skill alone. That's what human medicine is, Taiyang said, finally allowing herself to feel the triumph of success. It's not about having the best equipment. It's about refusing to give up no matter what. 6 weeks after the explosion, Minho walked into the medical bay without assistance. It was not a perfect walk. His left leg still had a slight limp and he moved carefully, aware of his body's limitations. But he was walking, on his own, without crutches or support, just 6 weeks after an injury that should have killed him. Taeyang looked up from her desk and smiled. Show off. Doctor's orders were to exercise the leg. Minho grinned back. I'm just following instructions. How does it feel? Sore, stiff, but it works. He sat down in the chair across from her. The physical therapist says I'll have full function back in another month or two. Maybe a little longer? That's remarkable progress, and it was. Even with the best alien regeneration technology, this kind of injury would have taken months to heal. Minho had done it in weeks using his body's natural healing ability supported by therapy and determination. I heard you're leaving, Minho said, his expression turning serious. Just for a few months. The Central Medical Academy wants me to teach. Taiyang had mixed feelings about it. Part of her was excited. Part of her worried about leaving the ship, leaving her patients. You should go. What you did, what you know, other people need to learn it. Minho leaned forward. I'm walking because you refused to accept that I was too injured to save. That's worth teaching, Taeyang nodded. I suppose it is. The communication system chimed. Captain Hyojin's voice came through. Dr. Park, please report to the conference room. We have an incoming transmission from the Galactic Medical Collective. The conference room was already crowded when Taeyang arrived. Captain Hyojin, Vreet, Thren, Sunwoo, Jiwan, and several other crew members had gathered. The large holographic display showed a dozen alien faces, representatives from the medical collective. One of them, a being whose species Taeyang did not recognize, spoke first. Dr. Park, we have reviewed Supervisor Vreet's report on your emergency surgical procedure. We have also examined the patient's recovery data. The results are exceptional. Thank you. Taeyang was not sure what else to say. We are formally adopting your techniques into Galactic Medical Protocol. The human emergency response procedures will be taught at every medical facility in the collective. All practicing medical professionals will be required to complete basic training. The room erupted in applause. Taeyang felt her face flush with embarrassment and pride. Another voice joined the transmission. It was Kyungmin calling in from Earth. Congratulations, Taeyang. You've given the galaxy something valuable. The knowledge that optimal conditions are not always necessary for optimal care. The meeting continued, discussing details of the training program, the protocols that would be implemented, the research that would follow. Taeyang answered questions, explained her reasoning, shared her experience. When it was over, she felt exhausted but satisfied. Vreet approached her as the others left. I have something to show you. The crystalline alien led Taeyang to the medical bay's computer system. She pulled up a file, a dense document filled with medical terminology and procedural guidelines. This is the official protocol document, HERP, as they are calling it. Vreet's light pulsed with what Taeyang had learned to recognize as amusement. The name is unfortunate, but the content is sound. Taeyang scanned through the document. It was all there. Triage procedures, emergency surgical techniques, field medicine practices, everything humans had learned over thousands of years now codified for the entire galaxy. There is something else. Vreet pulled up another file. My own species' medical procedures updated to incorporate human techniques. We are calling it integrated medicine. The combination of our technological capabilities with your adaptive practices. That's incredible. Taeyang read through the procedures. They were elegant, combining the best of both approaches. You changed how we think about medicine, Vreet said quietly. Not just my species, but all of us. We had become dependent on perfect conditions. You reminded us that medicine is about saving lives, not about following protocols. Protocols exist for a reason, Taeyang said. They do, but they should serve the patient, not the other way around. Vreet's form seemed to shimmer. That is what you taught us. The days passed quickly after that. Minho continued his recovery, progressing every day. The other injured crew members healed as well, all of them benefiting from the combined human and alien medical approaches. The ship completed its repairs. The engine was rebuilt, stronger than before. The damaged sections were sealed and restored. Life returned to normal, or as normal as life on an exploration vessel could be. 3 months later, Taiyang stood in front of a classroom at the Central Medical Academy. The room was filled with students from a dozen species. Some had crystalline bodies like Vrit. Others were insectoid like Thren. Some were humanoid. Others were completely alien in appearance. But they all shared one thing. They wanted to learn. Medicine is not about technology. Taiyang began her lecture. Technology is a tool, and tools are useful. But medicine is about understanding life, understanding the body, understanding how to help it heal. She pulled up an image on the display behind her. It was the cargo bay on the ship, converted into an operating room. This is where I performed emergency surgery on a colleague. The conditions were not ideal. The equipment was basic, but it worked because I understood the fundamental principles of what I was doing. A student raised a tentacle. But surely modern facilities are better. Of course they are. If I had access to a regeneration tank, I would have used it. If I had AI surgical assistance, I would have welcomed it. Taiyang smiled. But I did not have those things. So I used what I did have. Knowledge, skill, determination. She spent the next hour walking them through the procedure, every decision, every technique, every moment where she had to adapt and improvise. The students listened with rapt attention, taking notes, asking questions. At the end of the lecture, a young crystalline student approached her. Dr. Park, I have a question. Go ahead. What do you do when you are not sure? When you do not know if your treatment will work? Taiyang thought about Minho lying on that table, his life hanging by a thread. She thought about the moment his heart rhythm went chaotic, the uncertainty, the fear, the determination to keep going anyway. You do your best, she said finally. You use every bit of knowledge you have. You try everything you can think of. And you never ever give up, because as long as the patient is alive, there is hope. That is the first rule of human medicine. What is the second rule? The student asked. Taiyang smiled. Never underestimate what is possible when survival is the only option. Back on the ship, life continued. Captain Heejin logged another entry in her expedition report. She wrote about the explosion, the injuries, the emergency surgery. She wrote about how human and alien medicine had combined to save lives. At the end of the report, she added a personal note. Humanity's contribution to the galactic community may not be our weapons, our technology, or our discoveries. It may be something simpler and more profound. We teach others that perfection is not required for success. That determination matters as much as equipment. That the willingness to try, even in impossible circumstances, is itself a kind of strength. She sent the report and leaned back in her chair. Through the window, stars streamed past as the ship continued its journey into unknown space. There would be more challenges ahead, more dangers, more situations where quick thinking and adaptation would be necessary, but now they were prepared. Human and alien crew working together, combining their strengths, learning from each other. In the medical bay, Vrit was training 2 new medical students. One human, one from her own species. She was teaching them integrated medicine, the protocols that combined technological precision with human adaptability. Remember, she told them, the goal is not to follow rules perfectly. The goal is to save lives. Sometimes that means following protocol. Sometimes that means throwing the protocol out and doing what needs to be done. The human student nodded. The crystalline student's light pulsed with understanding. Somewhere in the galaxy, other doctors were having similar conversations. Learning that medicine was not just science, it was also art. Not just knowledge, but also instinct. Not just technology, but also determination. The human approach to medicine was spreading, not replacing alien techniques, but enhancing them, adding flexibility to precision, adding adaptability to advancement. And in a hospital bed on a colony world, a patient woke up from surgery performed using the new integrated protocols. The doctor, a being whose species had never performed surgery without full technological support, smiled with satisfaction. The surgery had been done in a remote clinic with basic equipment. But it had worked. the patient would recover fully. The doctor looked at their hands, still amazed that such primitive tools could accomplish so much. They thought about the human who had started all this, the doctor who had refused to let protocol prevent her from saving a life. Maybe, the doctor thought, the humans were right. Maybe the most important medical tool was not technology. Maybe it was the simple, stubborn refusal to give up. In the end, that was what human medicine had always been about. Not fancy equipment or advanced technology, though those helped, but the fundamental belief that life was worth fighting for, no matter how bad the odds looked.